When it comes to personal hygiene, few topics spark as much debate and confusion as the use of body wash and specialized vaginal washes for feminine care. For decades, advertisements and social pressures have fueled the idea that women need to go above and beyond to keep their bodies, and especially their intimate areas, clean and fresh. Rows of brightly colored bottles line store shelves, promising everything from odor control to pH balancing, often marketed as essential tools for modern self-care. But beneath these glossy promises lies a crucial question. Are these products truly the superheroes of feminine hygiene, or do they hide dangers that women should be wary of? To understand this, it's important to first look at how the vagina maintains its own health. The vagina is a remarkable organ, equipped with a natural self-cleaning system that relies on a delicate balance of good bacteria, primarily lactobacilli. These beneficial bacteria help maintain an acidic environment, which in turn keeps harmful bacteria and yeast in check. The vaginal walls secrete fluids that naturally flush out dead cells and unwanted microbes. So in most cases, the vagina is perfectly capable of keeping itself clean without any outside assistance. However, the external area, the vulva, does collect sweat, urine, menstrual blood, and other bodily fluids, which is why regular washing with plain water or a gentle, unscented soap is generally recommended. But many women, influenced by cultural norms and relentless marketing, mistakenly believe that thorough cleaning inside and out, often with fragranced washes or douches, is the key to health and comfort. This is where problems can begin. Many body washes and vaginal washes contain harsh chemicals, artificial fragrances, dyes, and preservatives. While these ingredients might make the product look and smell appealing, they can also disrupt the sensitive balance of the vaginal ecosystem. Scented washes and douches may temporarily mask natural odors, but they can also strip away the protective mucus and healthy bacteria, leaving the vagina more vulnerable to irritation, infections, and inflammation. For instance, the use of fragranced or antibacterial soaps can lead to common issues such as bacterial vaginosis and yeast infections. Bacterial vaginosis occurs when the healthy balance of bacteria is disturbed, allowing harmful bacteria to multiply. Symptoms can include unusual discharge, odor, itching, and discomfort. Similarly, removing too many lactobacilli can make it easier for yeast to overgrow, causing the itching and burning associated with a yeast infection. Moreover, some women experience allergic reactions to the chemicals found in these products, leading to redness, swelling, itching, or even painful sores. In more severe cases, repetitive use of harsh washes can cause microtears in the vaginal lining, which not only cause pain, but can also increase the risk of sexually transmitted infections by allowing pathogens easier entry. Despite these risks, the myth persists that the vagina needs specialized cleaning products to remain healthy and odor-free. This misconception is rooted in a combination of cultural taboos about female bodies, social expectations around cleanliness, and aggressive marketing by companies eager to turn normal bodily functions into problems that need solving. It's important to recognize that the vagina does have a natural scent, and this is completely normal. Odors can fluctuate based on factors like diet, hormonal changes, menstrual cycles, and sexual activity. A mild, slightly musky scent is usually no cause for concern. Only strong, unpleasant odors, especially if accompanied by unusual discharge or discomfort, should prompt a visit to a healthcare provider, as these may be signs of an infection or other medical condition. So, what should women do to maintain optimal vaginal health? The answer is surprisingly simple. Less is often more. The best approach is to wash the external genital area, the vulva, with lukewarm water and, if needed, a small amount of mild, fragrance-free soap. There is no medical need to wash inside the vagina. In fact, doctors strongly advise against douching or using any internal washes, as these practices can do more harm than good. Clothing choices can also impact vaginal health. Wearing breathable cotton underwear and avoiding tight-fitting pants can help prevent irritation and allow the area to stay dry and comfortable. During menstruation, changing pads or tampons regularly, every 4 to 6 hours, is important for hygiene. But again, there's no need for any special cleaning products. For those who experience dryness, itching, or irritation, it's best to seek advice from a healthcare professional rather than reaching for over-the-counter washes or sprays. These symptoms may be caused by an underlying medical issue that requires targeted treatment, not just a cosmetic fix. The conversation about vaginal washes also raises important questions about body image and self-esteem. Many women feel pressure to conform to unrealistic standards of cleanliness and freshness, often perpetuated by media and advertising. This can lead to shame or anxiety about their bodies, which has real consequences for emotional well-being. It's crucial to challenge these narratives and embrace a healthier, more informed perspective on what it means to care for one's body. A growing number of gynecologists and women's health experts are speaking out against the unnecessary use of intimate washes. They argue that these products are not only redundant, but potentially dangerous, contributing to a cycle of irritation and infection that keeps women coming back for more products in a misguided attempt to solve problems the products themselves may be causing. That said, the market for feminine hygiene products continues to expand, with new products claiming to be pH-balanced, gynecologist-tested, or natural. While some of these products may be less harsh than traditional scented soaps, the fact remains that most healthy women do not need anything beyond gentle, basic hygiene practices. Reading ingredient labels and being cautious about anything that contains fragrances, dyes, or unfamiliar chemicals is always wise. For women who enjoy the ritual of self-care and want to include their intimate areas, there are safer options. Using unscented hypoallergenic products designed specifically for sensitive skin can reduce the risk of irritation. Moisturizing with coconut oil or other natural plain oils may also be soothing for some. But it's important to patch test any new substance and consult a healthcare provider if there are any concerns. Ultimately, the idea that the vagina and vulva require special cleaning products is more a product of marketing than medicine. The narrative that the vagina is dirty or in need of constant intervention undermines body confidence and distracts from the real issues that impact women's health, such as access to quality health care, education, and the ability to make informed choices about one's body. Education is the best defense against misinformation. Parents, educators, and healthcare providers can help by teaching young women about the natural functions of their bodies and the importance of respecting their own comfort and health over societal pressures. Open conversations about vaginal health can reduce stigma and empower women to make choices that are right for them. In summary, while body washes and specialized vaginal washes are often marketed as essential allies in the quest for cleanliness and confidence, they can pose hidden dangers that outweigh any perceived benefits. The vagina is a self-sustaining ecosystem that, in most cases, requires little more than gentle care and respect. Overuse of washes and douches can disturb its natural balance, leading to irritation, infection, and unnecessary anxiety. By prioritizing accurate information and simple hygiene practices, women can protect their health and embrace their bodies without fear or shame. In the end, the real superhero is the body itself, when left to do what it does best.